Welcome, everyone. My name is Haley Buckner, and I'm the Professional Relations Manager for Elevate Oral Care. Thank you so much for joining us this evening. Before we get started, I'd like to take a moment to cover a few quick housekeeping items. For those of you who remain online for at least 50 minutes, your CE certificate will be emailed to you within hours of this presentation. Please be sure to check your spam folder just in case it ends up in there. Everyone is currently muted, so there's no need to worry about background noise during the session. We will have some time for Q&A at the end of the presentation, and you can submit your questions via the webinar dashboard as we'll be tracking them throughout the talk. We've hosted an extensive series of free live CE webinars on a variety of prevention topics. These webinars are recorded and available for free self-instruction CE at the website you see on the screen, elevateoralcare.com/elevatingcare. Be sure to bookmark the page and check back often for new CE opportunities. If there's a specific topic you'd like us to cover in future webinars, feel free to send your suggestions to info@elevateoralcare.com or complete the webinar survey that will be sent to you after this evening's session. We love receiving your ideas and often design our webinars based on your feedback. Tonight, we are honored to be joined by Dr. Marielle Pariseau. Dr. Pariseau is a dentist, educator, entrepreneur, and professional speaker whose work reframes oral health as a key to systemic health and prevention. She holds a doctorate in dental medicine from the University of Montreal, along with advanced certifications in caries management by risk assessment from the University of California, San Francisco, chronic disease prevention from the University of Toronto, and social entrepreneurship from the University of Pennsylvania. Her TEDx Salt Lake City talk, Teeth, Your Body's Early Warning System, has reached over 1 million viewers worldwide and continues to inspire audiences to see teeth with new eyes. Dr. Pariseau has spoken at national and international conferences, engaging healthcare professionals and rethinking the role of dentistry in chronic disease prevention. She was a semifinalist at Yale University's Global Health and Innovation Conference and has received recognition as an award-winning speaker. In addition to her professional practice, Dr. Pariseau has dedicated hundreds of hours to serving underserved populations in Canada, the United States, and Nicaragua. Her work as an inventor, researcher, and change architect reflects a lifelong commitment to bridging dentistry and medicine, challenging silos in healthcare, and advancing prevention at both the clinical and public health levels. Dr. Pariseau combines her decades of clinical experience, academic training, and public engagement to argue for a paradigm shift, recognizing dental caries as a Sentinel Health Event and using the mouth as a map to better systemic care. You guys are in for a treat this evening, and without further ado, I'm going to turn it over to you, Dr. Pariseau. Thank you so much for being here.
Sentinel health events are defined as preventable conditions whose occurrence signals underlying system failures. To qualify as a Sentinel health event, the condition must be measurable and preventable. Is caries measurable and preventable? Of course it is. We've been measuring it for decades with DMFT, DMFS, ICDAS, and other means of measurement. Is it preventable? Of course it is. We've been doing this also for decades with educating our patients to better brushing, more flossing, applications of fluoride. We are able to prevent the occurrence and recurrence of caries in our patient's mouth. So we can check this box. Caries is definitely measurable and preventable. Is it responsive to public health interventions? Well, yes, it is. In 1951, community water fluoridation became policy in the United States. And it was so successful that by 1983, public health experts predicted the disappearance of tooth decay. That's how they called caries back then. They predicted the disappearance of tooth decay by the turn of the century in children and young adults. And the World Health Organization named community water fluoridation one of the top 10 public health interventions of the 20th century. We can check this box too. Caries is definitely responsive to public health interventions. Is it reflective of social or structural determinants? Yes, it is. We've all heard about the social determinants of health, where your zip codes will determine how healthy or unhealthy you will be. Well, you have it. There are many population studies that point to the fact that in vulnerable zip codes, the incidence of caries, early childhood caries in children is quite high, and the incidence of non-communicable diseases is also quite high. We can check this box too. So yes, caries meets all of these conditions, but there is a fourth condition. Is caries predictive of a broader systemic risk? And we need to unpack this one a little bit further. We've already looked at the fact that enamel, mature enamel, is acellular, and this is a golden flaw with diagnostic power. It can predict or warn us of environmental imbalances affecting the whole body. Analysis of remains and historical records across dietary transitions consistently show that dental caries increases before other chronic diseases or systemic diseases. And in modern cohorts, caries in children correlates with poor diet quality, obesity risk, metabolic syndrome later in adolescence. Caries often appears years before the body mass index increases or metabolic syndrome is diagnosed. I think we can check this box as well. Caries is a Sentinel Health Event. Now, to further cement this, we're going to look at more modern populations who were exposed very late in westernization. And these are the Inuit populations in Alaska, Canada, and Greenland, Australian Aborigines people, the Pima Indians, South African urbanization population, like the Black South African who chose to migrate to cities in South Africa, and the Tokelau Island people. The Inuits had a low-carb, high-fat diet, and they had no to extremely low incidence of caries or chronic diseases. The Aborigines people had a diet of whole plant foods, wild game, fiber-rich, low in simple carbs, low incidence of caries and non-communicable diseases. So were the Pima Indians, who had a diet of beans, squash, mesquite, cactus. They were doing fine. And the Black South African, before moving to large urban sites, also had a low incidence of caries and non-communicable diseases. But the best studied population is a population from the Tokelau Islands. These are small atolls in the Pacific, and researchers followed populations in that part of the world for 15 years, starting around the 1960s. Some people chose to remain on their atolls and retain their traditional way of life and eating, and some others migrated to New Zealand because of the attraction of westernized world and everything else. At point zero of that transition, the Tokelau children had a very low incidence of caries, and there was a very low incidence of non-communicable diseases. Within one generation, the incidence of caries in children had more than doubled, and within decades, the incidence of type 2 diabetes, obesity, non-alcoholic fatty liver diseases had skyrocketed. Now, this is the experience of one, my own. For those who've seen my TED Talk, you've seen this photo. It's a stock photo of a child that appears healthy, no sign of caries, but unless we look really close at the teeth, we cannot state that for sure. And now this one is a photo I took myself in a free clinic here in Utah. This is a toddler who has clear evidence of early childhood caries. It is quite advanced and it's affecting several teeth. This toddler is of normal weight and it appeared healthy at the time of the encounter. And this one, I apologize for the poor quality of the photo. This photo was taken when this patient was 5 years of age, and it was 1 year after an intervention for full mouth rehab in the hospital with general anesthesia. At the time of the encounter, that child was healthy looking and of normal weight. And the mom was quite happy with the appearance of her child's teeth, and she really thought that everything was fixed. Is everything really fixed? Well, maybe not. And this brings me back to the fork in the road that happened, the division of dentistry and medicine that happened in 1840. Back then, in 1840, caries was already the most prevalent chronic disease. There were two dentists who knew that. That was Chapin Harris and Howard Hayden, and they were seeing caries in the mouth of literally all of their patients. But medicine was also in crisis. This is happening in Baltimore, Maryland. It's a port city, it is crowded, it is unsanitary, and medicine is in crisis. It is overwhelmed with infectious diseases. Imagine a port city with ships coming in regularly and bringing with the cargo yellow fever. Physicians are dealing with regular epidemics of yellow fever, typhoid fever, tuberculosis, cholera, and their patients are dying by the thousands. In addition, they're still 20 years away from the germ theory of diseases. What they have to help patients is purging, bloodletting, and observation. People are dying by the thousands. So when Hayden and Harris approach the College of Physicians and say, hey, we're saying problem is in the mouth, you know, there's those cavities on teeth, and we think that dentistry should be integrated into medicine. Well, according to Mary Otto in her book, Teeth, she claims that the response of the physicians back then was that dentistry was of little consequence to medicine. And under the lens of what I just described to you, it kind of makes sense that the physicians reacted this way, but the consequences are dire. As a consequence of this split in the road, dentistry has been siloed for 185 years. Oral health has been excluded from medical records, medical training, and policy. And the chronic disease crisis begins to unfold, because when we solved the epidemics of infectious diseases, then chronic diseases started coming. Well, dentistry is of great consequence. The mouth is health's missing link. Without data from the mouth, healthcare is incomplete. The pattern is clear and repeatable. Enamel is a first responder to dietary imbalance in childhood, well before systemic disease appear in adulthood. When caries sounds the early alarm in the mouth, it reveals the same dietary stress that drives pancreatic exhaustion, liver overload, and brain insulin resistance. By acting at this visible and reversible stage, and when I talk about reversible stage here, I talk about chronic diseases, not just caries. So by acting at this visible, reversible stage, dentistry can move beyond repairing teeth to intercepting the very cascade that advances compensation into chronic disease. I'll let this sit for a little bit. Now that we know all this, we will take a metabolic dive deeper inside the body, starting with the mouth. Now, before I go any further, I have to tell you that I've created these diagrams, and they are a very simplified version of what actually happens throughout the body. But it paints a picture that is really important. In the mouth, we're really familiar with what happens. We have an increase in sugar intake that leads to more frequent acid production. As the frequency increases, we see the pH in the mouth lowering and lowering, an environmental shift that leads to an ecological shift where the beneficial bacteria such as Streptococcus sanguini and Streptococcus gordini are being replaced by the more sugar-friendly, acidogenic, acidophilic bacteria such as Streptococcus mutans and bifidobacteria. And with time, we fall into a disease state, caries. In dentistry, for decades, we have been able to reverse this cycle with oral hygiene improvements. We teach and coach our patients to brush better. We teach them how to floss. We stress the importance of doing so. Fluoride applications, fluoride prescriptions, and we can actually reverse the state of disease to a state of health and prevent the occurrence or recurrence of caries in our patient's mouth. The liver is a really interesting organ. When we have an increased intake of carbs and sugar, the liver goes into de novo lipogenesis. It takes the carbs, it takes them apart and makes them into fat. And it accumulates those fats in the form of triglycerides into its own cells. And as a result, the liver starts down-regulating the insulin receptors. Because insulin is responsible for allowing glucose to go into cells to fuel them. But now these cells are clogged with fat, and we have insulin resistance. And as this goes on and there's more and more fat in the liver is really challenged in its capacity to regenerate itself. And we see true insulin resistance that eventually leads to non-alcoholic fatty liver disease. And as I mentioned before, Dr. Robert Lustig is now diagnosing this disease in children as young as age 8. Is this reversible with better oral hygiene? Let's move to the pancreas. Increased sugar intakes leads to spikes in blood glucose, and we've already seen what happens in the liver, that it starts down-regulating the insulin receptors. As a result, the beta cells in the pancreas have to work harder and harder, and they hypertrophy. As a result, they become bigger and they work harder to produce more and more insulin because the body is no longer responding to the insulin as well as it used to. But eventually, the insulin output can no longer meet the demand. The beta cells are so stressed that some of them start going into apoptosis, like the amyloblast went in the eruption of the teeth, and you enter a state of disease and type 2 diabetes. Is this reversible with better brushing and flossing? Probably not, huh? Now let's have a look at the gut. What happens in the gut with an increased sugar intake? And here we have a bigger challenge because ultra-processed foods, as we saw earlier, they are high in sugar, low in fiber, and this impacts the gut twice. So the increased sugar intake favors the rapid carbohydrate utilizers, and they benefit from it. And as a result, we see an ecological change within the gut, where the beneficial commensals, the beneficial bacteria, are being replaced by opportunists. And as a result, you have gas, acid, endotoxin production. And then we move on to see an increase in intestinal permeability, but this is also linked to the lack of fiber in ultra-processed foods. Because in our gut, we have bacteria that are responsible for digesting, fermenting the fiber in the diet. And if you don't feed them fiber, you are starving them. The problem is these bacteria are responsible for forming short-chain fatty acids that keep the mucus layer of the gut healthy. It keeps the lining of the gut healthy, and it keeps our immune system healthy. So when we have a reduction in the short-chain fatty acid, we eventually end up in a state of dysbiosis, and it's not reversible, being reversed with better brushing and flossing. And now that we've taken a deep dive into the body, we're going to resurface through the mouth, take a deep breath, and have a look at the brain. What happens when we have an increased sugar intake? We all know that the brain needs glucose. That is the fuel for the brain, and the brain needs a steady influx of glucose to function properly, not sugar spikes. Because when we have glucose spikes, it leads the brain to release the hormone dopamine. That is the feel-good hormone that eventually leads to cravings, and the reward circuits demand more and more sugar, which means that we have more and more sugar spikes, and which in turn leads to mitochondrial stress and insulin resistance in the hippocampus and the cortex. And that leads to a decline because of that, because of the insulin resistance. It leads to a decline in the brain-derived neurotrophic factor. And this happens to be a factor responsible for higher cognition, higher learning, memory. And as we see declines in the brain-derived neurotrophic factor, eventually we move into cognitive decline, which is reversible if we catch it not too late into the disease itself, but it's certainly not reversible with better brushing and flossing. I think I made my point. Recognizing caries as a Sentinel Health Event can spark a transformation in medicine and public health, comparable to the breakthrough brought on by the germ theory of disease. And with this, we will examine parallels between the two theories. The germ theory of disease came around 1860 with Louis Pasteur, and then followed by Koch and Semmelweis, and they discovered really important facts. So let's compare the two. The germ theory of the 19th century revealed invisible causes for disease. Caries as a Sentinel Health Event theory reveals invisible impacts of metabolic imbalance. The germ theory linked observable symptoms to a root biological cause. The Caries as a Sentinel Health Event theory links visible decay to systemic, nutritional, and metabolic dysfunction. The germ theory triggered hygiene, antisepsis, and vaccines. The Caries theory calls for dietary reform, food system changes, and early metabolic intervention by us. The germ theory transformed public health, clean water, sanitation, and the Caries theory calls for oral systemic health integration and prescription for real food. The germ theory integrated science into clinical care. The Caries theory, that Caries is a Sentinel Health Event, calls for reintegration of dentistry into medicine. The germ theory focused on acute infections. The Caries theory focuses on early warning signs of non-communicable diseases. Non-communicable diseases, including caries, are largely preventable. Investing in early detection, prevention, and lifestyle changes could save billions of dollars and thousands of lives. Let's have a look at the economic burden. The total cost, and these figures go back to 2022-ish. Those numbers are probably even higher now. So the total annual cost is over $4.1 trillion per year, and this is in direct medical costs and loss of productivity. 6 in 10 Americans live with at least one non-communicable disease. 4 in 10 have 2 or more, and 90% of the United States healthcare costs go toward treating non-communicable diseases. This is huge. And it seems daunting, but what if we look at it just from the perspective of a really, really small shift? 1%. 1% seems feasible. We can all do that, right? So even a 1% shift will save $41 billion. It will save lives, and it will improve the quality of life of millions of Americans. This is big. So what is the way forward? And on this page, on this slide, you will see a daunting list of what needs to be done in order to achieve Caries as a Sentinel Health Event. If we choose to embrace this new paradigm that Caries as a Sentinel Health Event, there's a lot of work to be done. And here it is. We need to integrate Caries as a reportable condition into national surveillance. This is a big ticket item. But this one in blue is easier and doesn't really require policy change. It's called trigger-based interventions. Literally, when we see Caries, we prescribed new interventions of nutrition counseling or chronic disease screening. And we'll look at this a little bit more detail in a moment. It requires interdisciplinary training. Embed oral, systemic, and nutrition curricula in dental, medical, and public health schools. This is another big ticket item, and it's not going to happen overnight, but we need to go there as well. We need to promote team-based models in primary care, and this we can start now. We need to integrate oral health with general health systems. Dentistry needs to be part of this. We need to integrate targeted data from the mouth into electronic health records. And I've been working on a model for integration into electronic health records that is meant to not overwhelm or already overwhelmed physicians' friends with having to do more and more in less and less time when they encounter patients. So I have the beginning of a model that we can use as an integration possibility. And a call for a joint declaration from the World Health Organization, the Fédération Dentaire Internationale, and the World Federation for Public Health Associations to define Caries as a Sentinel Health Event. And I think they're ready for that. So, the easy part, the 1% that I promised in my introduction. Take time to redefine your role as a first responder in non-communicable diseases. If the members of your team are not part of this session tonight, invite them to see the recording later. And as part of your next team meeting, explore your role, or maybe even include the visioning of the recording of this presentation into your next team meeting and explore together as a team what will be your role as a first responder when you embrace the theory that Caries is a Sentinel Health Event. What new interventions will Caries trigger? And please call it by its name, Caries. When we call Caries as a cavity, tooth decay, a little spot, we minimize the importance of this disease and the impact it has on the whole body. Call it by its name. Deepen your knowledge in nutrition. And if you happen to have a team member who's interested, keen in learning more in nutrition, maybe invest in further advanced education in nutrition for that team member who can eventually become the nutrition coach for the patients who need nutritional coaching after a diagnosis of caries in your practice. Implement a caries checklist, and I will share one with you in the next slide, and this will transform your practice as well. Get to know the healthcare providers in your area. Ask a team member to make a list of the healthcare providers you share patients with. It's not going to be a very long list, but make a list, know their name, where they are. Visit them. This is important because you will, during that visit, connect teeth to health, explain the theory that Caries is a Sentinel Health Event, and explain the importance of them knowing what's happening in their patient's mouth. And the beauty of the visit is when you start sending notes to the primary care physicians, there will be a face on that note. And your note is more likely to be honored and acted upon if you have done a visit. Visit schools, talk about sentinels and food. I have been visiting schools ever since I was in dental school. I love interacting with children. I still do it today. Visiting school is probably going to be, if you don't do it yet, your best marketing investment in your whole practice. Connect teeth to health in schools as well. Reclaim your role as a leader in prevention. We've always been leaders in prevention. We've always talked about prevention. We can deepen that role because you can be a leader in restoring not just teeth, but health. And all this you can start right now or tomorrow morning. Here's the caries checklist I promised you. This checklist I made from knowledge that I've acquired from Atul Gawande. He's a physician who did a TED Talk on checklists in operating rooms in hospitals, and he wrote a whole book on it. In his talk and in his book, he talks about the importance of pause points. And in this caries checklist, the pause points are these. Number 1, upon diagnosis of caries. Number 2, before initiating local treatment of caries. And number 3 pause point is after the completion of local treatment. In the first checklist that goes with the first pause point, we ask, is the caries reversible or irreversible? Is it one or multiple teeth? Is it a first occurrence or a recurrence? And does the patient even know that they have caries? And before initiating local treatment, you have to do a 3-day food journal. 2 weekdays, 1 weekend day. Has it been completed? Has it been reviewed? And make sure that the team members know how to connect the journal to the disease. And here I have to report an embarrassing anecdote. Years ago, I had a fairly new team member on board. We have a teenager in the chair diagnosed with caries, and I'm called for a hygiene check. I tell my team member to go over nutrition with the patient. I go. As I walk back by the operatory, I hear the teenage patient asking, so chips are a good choice for a snack then? And I hear my team member saying, yeah, they're salty. That's a good choice. I had to take a deep breath, and I was so embarrassed because we all know that potatoes are fermentable carbohydrates. They are quickly transformed into simple sugars in the mouth. Chips are cariogenic, and no, they are not a good choice for a snack. Same list, we need to check also that has a family physician or pediatrician been contacted. Now, the third list, we have completed the local treatment of caries. Who needs to be alerted? The pediatrician, the school nurse, and what consultations are needed, depending on the severity of the disease. Dietitian, nutritionist, pediatrician, endocrinologist. And then last but not least, how often should we see this particular patient now? Does it make sense to see a 3-year-old who just completed full mouth rehab for caries, to see that patient at the same interval? You're going to see a patient who's an adult who has not had an occurrence of caries for years. And here's a really simple chairside protocol. It addresses a child and the language we can use to connect teeth to health, to say the word caries even with a little child in the chair and move forward from that. Name the signal and ask the child, see this little white spot? And we still use white spots. So see this little white spot? That's your tooth saying, I'm tired and I have caries. Can you say caries? Yeah. So your tooth is telling you, I have caries from too much sugar and acid. And then we add on, your teeth are little superheroes, and now this one is tired. And it's warning us that your body is also in need to stay strong. So how are we going to do this? And the duo plan here is based on motivational interviewing that was published by Rolnick and Miller quite a few years ago, where you involve patient participation in some of the decisions they will make to improve their condition moving forward. So we'll ask the child for one goal regarding the teeth. Let's swap one soda or juice for water or milk each day. And you let the child decide, what is it going to be? At which meal is it going to happen? And then one goal for the body. So then you connect the teeth and the body with what's happening. And let's do or add one fruit or veggie to a meal. And you let the child decide which fruit or veggie it's going to be and what meal. And then you move forward with screening. Now, let's imagine that this encounter with a child that has quite advanced early childhood caries. So you can say something like, sometimes teeth give us the first clue. Let's check with your doctor to keep your whole body strong. And the parent who may be in the room will hear that message as well. And you coordinate with the primary care physician, the pediatrician, for A1C screening or lifestyle coaching. Now, to close the loop, this becomes a little more challenging, but not so much. For motivation, we need to check in sooner than later because motivation will slowly decrease as the weeks go by. So if you want to check on the plan, you're going to want to check on that within 3 to 4 weeks because of the motivation waning factor. Is it reasonable to ask the parent to bring the child back just to check on motivation? Probably not. So this can be done by phone or on a Zoom call where we check on the motivation, the goals, are they still in place? How is that working and whatnot? And when it comes to remineralization, we know that this takes longer. So we're not really going to see significant improvement in 3 to 4 weeks. It's going to take more 3 to 4 months. So we're going to want to see that patient in 3 to 4 months to check on the status of the lesions that we saw and see how things are going. And we're going to escalate if things are not improving. What is possible? A lot. This picture is very evocative to me because it represents what happened to dentistry back in 1840. We have been put in a cage and forced to operate on a system that expands well beyond the bar of this cage, up laterally and downwards into the roots. And if and when we embrace Caries as a Sentinel Health Event, we actually open this door to this cage. And we start seeing teeth with new eyes, and we deepen our restorative power. because now we can address the branches and the roots of this tree that's within the cage. Dentistry is no longer relegated to the cage or to the edges of healthcare, but it reclaims its role as a leader in prevention. This is a big shift. So, beyond the management of caries, what is your 1% that you will get started with now? Because every day you restore teeth, function, and confidence. What if your next great act of restoration wasn't in the operatory, but in healthcare itself? I leave you with this thought.